for health news now. It is one of the most popular vision procedures in the country. More than 1 million LASIK eye surgeries are performed in the U.S. each year. But there are some things you should know about the surgery, choosing the right doctor, and some of the new advances. And today we're pleased to welcome Dr. Lance Ferguson, the surgery director of Commonwealth Eye Surgery, who is also the current president of the American College of Eye Surgeons. And he has some important advice and updates. And I know so many people with any procedure really wants to make sure that they're finding the right person to do it, right?
That's the biggest concern. You know, have they done this a few times, or is it their first escapade in actually providing the surgery, and how much experience they have, and how many types of surgeries they perform.
And as a member of and president of the American College of Eye Surgeons, I know that's certainly one of the things that people would like to look for in recognizing the surgeons that have a lot of experience. And your group in particular has a wonderful rate of success with these procedures.
They do. Our group actually tests surgeons repeatedly on 7-year bases. So as the techniques and the technology changes, we make sure that our surgeons are up to date, and we look really closely at their data and their outcomes. And that's a way we can reassure the public we're doing everything we can to keep up to date. You wouldn't fly an airline if their pilots didn't retrain, and we encourage that retraining and recertification of those skills every 7 years, excuse me.
And when LASIK was first introduced, it was such a major innovation in vision treatment, and a lot of people have had it done now, but it's still changing, and there are some new things that are being done to improve it.
Not only are the patterns of the treatment changing, and they're actually individualized to a person's given eye. We call that wavefront treatment, and we actually take a wave print of your eye and actually treat your eye with a specific algorithm, a treatment pattern. But we also actually had an improvement in the tracking. So when a person lays under the laser and they're worried, am I going to hold my eye still, the tracker not only tracks the eye up and down and left and right and vertically, but also if the eye spins. And it does that 50 times a second. So if we're going to treat in one area of the eye, say for example up and down, and the person lays down and their eye spun, a couple degrees left or right, then we're not going to be as accurate. But the new trackers allow us to do that, and any changes that occur during the treatment, they compensate for as well.
And what advice would you have if someone's considered, I was telling you during the break, it's something I've contemplated for a while myself. How do you know if you're a good candidate for it? What are the first steps you should take in deciding if the procedure's right for you?
The first thing you should do is educate yourself. And there's plenty of data out there, FDA.gov, and understand what the procedure entails. The second thing is to make sure that your workup is really thorough. And our success is we try very hard in the surgical suite, but it starts with Cinda and Rebecca and Jessica, the people that do our orb scans. They're better at those techniques than I am. Doctors Finley and Ciccone and Long and Dr. Smith have more than 100 years experience collectively in refraction. They do that better. And the reason my success, our success, is based a lot on those individuals. They get that data right, they answer the questions, and then we actually have a conference. We talk to the patient and find out what's good for them and what's not. The other thing I'd recommend is ask a surgeon, do they ever say no? Because some people are not good candidates for these procedures, and a lot of the difficulties that arise that have arisen in the past are due to some patients having the procedure performed correctly, but they just simply weren't a good candidate for it in the first place.
Well, some great information. Thank you for taking the time to be with us and share that. You've seen the phone number and the website at the bottom of your screen if you'd like to learn more about Commonwealth Eye Surgery. Dr. Ferguson and his colleagues would be glad to help you out. Thank you so much for being with us.